Welcome to Health on Traxx, and today we are talking to Andrew Yam, a pharmacist from HKL. Welcome, Andrew.
Good morning. It's a privilege and honor to be here.
So, Andrew, do tell us, what are antibiotics?
Well, firstly, I would like to just say antibiotics are medicines, just like any other medicine that you take, but this is very specific because it helps treat infections, which are usually caused by bacteria. And I would like to emphasize bacteria here because antibiotics are ineffective generally against, say, viruses, fungal infections, and those kind of infections that are not bacteria based, right? So just to give a bit of background, antibiotics have been used since the 1940s to
Yes,
save
yes.
lives. It's something that has been used very widespread in the world, and it has really reduced mortality and really treats a variety of bacterial infections, right? And the choice really depends on the type of infection, the type of bacteria involved, and also the condition of the patient after examination by a doctor. However, I think in today's world, the challenge is irrational and widespread use of antibiotics can really lead to an increase in antibiotic resistance.
So what is antibiotic resistant? What caused this incident?
I guess antibiotic resistance is really a condition, to put in very simple terms, is that when an antibiotic, right, is unable to treat a bacterial infection or unable to fight the bacteria because over time, as a person gets exposed to these antibiotics, the bacteria can mutate. They are very smart, right? They can
okay.
become resistant to even some of the antibiotics that we have taken before. Just a bit of background because I think within us, we have both good and bad bacteria that resides in us. So every time we consume antibiotics, it gives that sort of exposure, and they are very smart. They can tailor to this change,
Yes.
right? And they will strive to survive. I think if you have watched some of those medical dramas you
Yeah.
see on online and Netflix, right? Some of them
Yes.
mention this superbug called MRSA, or what we
Okay.
call MRSA. It's a methicillin-resistant Staphylococcus aureus, and this bug is actually a very resistant organism, which is also birthed out of the fact that we have used a lot of antibiotics. So this is just an example to give, right? I would like to just give a few factors. What causes this? I mean, a lot of people have this question like, is it something that just happens when I take my antibiotics? It's not always the case, because yes, antibiotics are used to treat bacterial infections, like I mentioned. But when we take them, when we have a viral or fungal infection, it is actually there is no role for antibiotics, right? The other reason that may cause this resistance is that when antibiotics are used for too short or too long a period,
Okay.
right? So, like for example, when we go to a clinic for treatment, the doctors give us antibiotics. They are usually prescribed for a certain period,
Yes, correct.
right? You have to comply to that period. Sometimes we stop it when we feel well,
Yes, yes, that's
or we,
true.
or we,
I
or
do
we,
that.
yeah, sometimes, right?
Yeah.
Or we take them. Let's say we don't feel really well and we ask for more.
Yes.
Yeah, sometimes that is also quite hazardous and contributes towards antibiotic resistance. Sometimes when we feel unwell, we see that the doctor has wrote like, oh, one tablet twice a day. But maybe we think that, okay, it's okay if I take an additional one, maybe I will get better faster. Well, that too contributes to resistance, right? Yeah. And the other thing that we shouldn't do is this: we shouldn't share. So, for example, if we are in a family of four,
Yeah.
and two of us went to see the doctor, and eventually the other two fall
Didn't-
sick,
yeah.
right? We shouldn't be giving them our antibiotics if we are prescribed antibiotics, because antibiotics are specific to the individual that was assessed by the doctor. Yeah, you shouldn't be going around and just distributing them, right?
Become the doctor instead.
Yeah, that's right. The other thing is this: exposure or excessive use of antibiotics in our livestock and pets as well, because that provides a certain exposure to us in what we consume and in the environment, can also contribute to resistance. If you have antibiotics that you have not used,
Okay.
and you somehow decide that next time I have a similar symptoms and I take them again, that also can cause resistance, because different, like I said from the start, different infections, different organisms or bacteria warrant for different sorts of treatment, which needs to be accessed by the doctor on an individual and situational basis.
Okay. Okay. So why is antibiotic resistance a problem? What is the impact on society?
Well, it is a worrying global health threat because I think primarily we all know that if a bacterial infection or any infection per se is not well treated, the worst possible outcome is, of course, death, right? And we want to prevent that from happening because it really poses such a great challenge to the healthcare scene because it really threatens the effectiveness of treating infections and basically at the end of the day saving patients' lives.
Yes, true.
Right. Just to give a bit of background, why this is really an emerging pattern is because antibiotics used to be produced in the masses in the last, let's say before the 1970s. They produced quite a number of antibiotics, right? But however, latest data from the United States Food and Drug Administration lists that between 2014 and 2019, and this statistic is a bit intimidating, that there are only 10 types of antibiotics being produced, right? And perhaps this, I would attribute it to the fact that, when we have existing antibiotics, we are comfortable with it, it works, it's effective. Then, of course, the ongoing research may have somehow also reduce because it works, right?
Yes.
So that we don't need to keep producing the same thing,
Yeah.
right? But however, when the emergence of superbugs started to show up, that's when we started to step on it again. And in the last, let's say, since 2020 to now, there are actually about 50 antibiotics in clinical trials.
50?
About 50.
Wow.
This is actually a data from the World Health Organization. Yeah, there are about 50 antibiotics which are being produced in the works in clinical trials. But as we know, clinical trials and phases take a long time, takes years.
Yes.
So it may be some time before they actually appear in the market for us to be able to use them. So at the end of the day, antibiotic resistance really increases our healthcare costs. I think the first thing that really you think about it, if the infection is not able to be treated, firstly from the public community, people will keep falling sick over and over again, right? And they end up in hospital.
Yes.
And hence they will have prolonged hospital stay as well if the infection is really difficult to treat. Secondly is antibiotic resistance can cause a widespread just spreading of these infections, right? Because from one person to another, they cannot be treated, not successful, then it continues to spread. And of course, at the end of the day, like I said just now from the start, resistant infections can really kill. And this is really the greatest challenge, and we do not want to see that happen, of course.
True, of course.
Every life matters, right?
What exactly is the right way to obtain these antibiotics? But hold that thought. We'll be back right after this short break on Health on Traxx. Welcome back to Health on Tracks with me, Andrew, from Hospital Kuala Lumpur Pharmacies. Yes, we are talking about do you really need antibiotics? And before the short break, I asked what exactly the right way to obtain antibiotics. So do tell us, Andrew, what are the right way?
Thank you for that question, Val. I think it's a really important question because I think nowadays with the access that we have, we can obtain anything and everything we want sometimes, right?
Yes, correct.
But I have to say this, and I would really love to emphasize this, that antibiotics can only be given by a registered physician or purchased with a valid prescription,
Prescription,
from a
yes.
physician at a community pharmacy. Without a prescription, pharmacists will not supply antibiotics. The public should not purchase antibiotics without a prescription, and this is in accordance to the Poisons Act 1952. And this is quite interesting because even when I go on, say, Shopee
Okay.
or Lazada, any of these online platforms, I find that I can actually purchase antibiotics on my
can?
own. Yeah,
Oh.
it's quite interesting to see, right? Because this is actually quite unauthorized.
Yeah,
and
yeah,
it's-
true.
and it's really uncontrolled because this contributes to my initial point just now, talking about resistance and its concerns that antibiotics don't work anymore as they should, right? And this really is something which we are looking to try to curb, because like I said from the very beginning, we cannot assume that having the same exact symptoms,
True.
the antibiotic that we have once taken before will work, and we just gotta search up or ask the pharmacist for
Or even
antibiotic.
ChatGPT.
Yeah, correct. Check GPT, any of those
Yes.
AI platforms, right?
Yeah.
So we do not want that to take place because then it will warrant not just the resistance part, it will expose you to harmful side effects. What if you don't have a bacterial infection? It's quite unnecessary.
True. Yeah, and you were mentioning, so can I stop taking antibiotics after a day of taking, like I feel very, like how you mentioned just now, oh, I feel healthy already. Can I just stop?
Not at all, actually, because like I said just now, imagine taking antibiotics as if you are going to battle, right?
Yeah.
You got to provide enough firepower, right, for the whatever you are battling to be reduced or suppressed, and you can win that battle, right?
Yes, correct.
So the same is with antibiotics. When we give antibiotics, when the doctors prescribe antibiotics, not just the dose really matters. The right dose needs to be
Yes.
given. The right period needs to be
time,
given,
yes.
right? Even if you feel well, you should continue consuming your antibiotics as directed by a doctor. Even your pharmacist, as they advise you. Because if not, this again goes back to the whole antibiotic resistance, like I was talking about just now, right? And not just that, antibiotic resistance really can lead to a reinfection. Because if you don't finish your antibiotics as prescribed, like I said, if you do not suppress it enough, then it will come back.
Yeah.
It will keep coming
It'll
back.
be recurrent.
And like I said from the beginning, it's very smart. It will come back in a
Yes.
different form with more defenses. And you need another type of antibiotic, right? Which is a bit more stronger. Yeah.
Okay.
And this really will just lead to the point whereby if you keep doing this, then the the bacteria will be so smart to the point that it's resistant to all
Yeah.
antibiotics, and we don't have treatment options for you anymore, right? So always follow the instructions as prescribed by the doctor or advised by the pharmacist to finish your antibiotics as prescribed, the dose and the period. So usually when they pack it for you,
Yes.
they pack it in just the right amount. Right, as they
Yes.
give it to you, it's just the right amount. You need to finish your antibiotics to ensure that whatever infection you are having is effectively treated.
Yeah, the doctor always say finish your antibiotic on time.
Yeah.
Yeah. Why is it said that a fever or cough or flu do not necessarily require antibiotics? When are antibiotics needed?
So actually, if you have common cold or a mild cough, mild low grade fever, most of the time, right, they are not bacterial infections. Most of the time, they are viral infections.
Viral. Oh,
Now
yeah.
there are differences. So for example, if you have COVID is a virus.
Yes.
Influenza A is a virus.
Yes.
And usually antibiotics are not used in these situations. Right? So
Not useful.
correct. So influenza A has antiviral. Right? And a lot of times, even for the low risk groups, we tend to recover from viral infections quite well.
Okay.
Right? So antibiotics are only effective for treating bacterial infections. They are not effective against viral or fungal infections even. And they are not appropriate if you take them inappropriately. Like I said again, they will cause resistance. And again, a lot of times, some antibiotics can cause quite nasty side effects. For example, when I take an antibiotic, just an example is an augmentin. If you have heard of augmentin before, it can cause very severe diarrhea when you take it. And if it's unnecessarily taken, then it just subjects you to you feeling even more so unwell than before.
Yeah, true.
Right? And of course, even sometimes you may develop reactions to it. So antibiotics are really only needed if the doctor has made a health assessment. Now, I've got to say this, not all cough, cold, fever, and things like that are completely viral. Some are bacterial. We cannot assume in general they are all the same, but this can be confirmed through blood tests.
That's why they asked to do blood tests.
Yeah,
Okay,
blood
yes,
tests,
yes.
and also a proper assessment by a doctor to differentiate between the two as to when you actually really need it.
Okay.
And the doctor has to confirm that. So they are the only ones who can determine whether antibiotics are needed or not, and to give them only when needed.
When
right?
needed, yes.
Yeah. So one of the common things I remember sometimes the public, as they come to the hospital, they share their experiences. A lot of times they say this, like, sometimes when I feel unwell,
Yeah.
I will actually ask my doctors for antibiotics.
Yeah.
And-
I do too.
Yeah.
Say, I want antibiotic, I would say.
Correct. So we just need to look at it from a different perspective now, that not all ailments or illnesses require antibiotics, like I mentioned. If it's a viral infection, then antibiotics are not needed, which is most of the time they are viral infections with common cold and flu, right? So we do not need to step into that threshold of taking antibiotics so quickly, right? So because they are not exactly needed, you just need to treat the symptoms. You can take some cough medication, some flu medication, and you will feel a lot better after a few days, right?
Okay.
So instead, you can ask your doctor, like what I said, what can be done to relieve the symptoms. If you need bed rest at home, then they need to provide you that rest.
MC.
Yeah, maybe MC if it's needed in an appropriate duration,
Yeah.
or even some time off if you need that from work. So yeah, not all conditions necessarily require antibiotics.
Okay, yeah, okay. We will be back to know more about antibiotics with Andrew Yam, a pharmacist from HKL on Health on Traxx. welcome back to Health on Tracks, and with me and is Andrew from Hospital Kuala Lumpur Pharmacies, and we're talking about, do you really need antibiotics? So Andrew, what is society's responsibility, especially patient, to ensure and maintain the effectiveness of antibiotics?
Thanks for that, Val. It's a good question. I think firstly, before we talk about even consuming antibiotics or even anything that we need to take, right, we need to talk firstly about prevention. And this boils down to personal hygiene. This boils down to also our food hygiene. And also really, remember growing up, we used to have these immunization schedules.
Okay.
So we need to adhere to those parameters
The
first.
injection.
Yeah, these measures first. I think it's first and foremost our responsibility to prevent infections from taking place by ensuring adequate scheduling, and also our hygiene is really well maintained. This is before even consuming anything, right? Secondly, just as I mentioned in my point before this, is that society shouldn't pressure our general practitioners or our physicians for antibiotic treatments, right? As I said, a lot of times, if the doctor really thinks that this is common cold or flu, which is caused by a virus, you do not need antibiotics, right?
Yeah, okay.
Antibiotics can also only be given by a registered doctor, purchased with a valid prescription from the community pharmacy. Now, I got to say this because a lot of times when we are given antibiotics or when we are given any medication of any sort, when we go and see the doctor, right? A lot of times we just receive whatever we are given, and we just head out and we just take them as instructed, which is really good. It's a start that you need to adhere. However, I think it's everybody's right to also ask out of interest and awareness, like, what am I taking?
Yeah, true.
Why do I need to take this? Is it completely necessary to do so? You can also really just gain some knowledge of what you are taking, and the awareness is so important as you are given medications, right? So just really casually ask. Do not have to be
Shy.
completely very adamant about it.
Okay.
You just gotta just very casually, very out of my interest, I want to know.
Yeah.
Why am I given this? You know.
True.
Yeah, it's your right to know that, right? And if a doctor gives the patients antibiotics, like I said, it's important to know that you need to follow as instructed. Always clarify the dosing. If you find that you have taken this antibiotic before, and when you go from different practitioner to practitioner, different clinics to clinics, you find that the dosing varies. Always walk into a pharmacy also to clarify. We can also clarify that for you. Or remember to always clarify before you even leave the clinic. That's the best.
Yeah,
right?
true. Okay.
Just to also solve the problem of why is there a discrepancy, or to clarify, right? So be very sure that you follow the instructions and the labels given. Once you have clarified everything, you know that this is the appropriate dose. Follow it as it's prescribed and finish them. Make sure that you complete the interval that you're given.
That's important.
That's important. You need to finish your antibiotics, right? Of course, you only take them, like I said, when the doctor confirms you need them. Do not rely on external sources. Do not treat yourself with excess antibiotics from home. And I think I would like to extrapolate this information to also pediatrics, whom sometimes when parents, we have antibiotic syrups at home for our children. Sometimes when we take these syrups, we only finish we have a little bit left, and we think that it's okay to give it the next time they have an infection. That's not true. Whatever you do not need, or you finish the prescribed duration and you have a bit of balance, you got to discard them, right? So if you're hearing this today, the public, the general public plays a role in this, because we all play a part in encouraging not just ourselves, but our family and friends with this awareness, right, that we need to use antibiotics responsibly, right? It is vital for this so that we can maintain our health well. We can be judicious. We can really use antibiotics appropriately and prevent resistance. So just to add this in, if you have expired, damaged, or unused medications at home, we have this portal called My MediSafe. Medi, M-E-D-I, Safe, which is accessed by www.mymedisafe.org.my to find collection points at any public health facilities, selected private hospitals, community pharmacies. It encourages, My MediSafe encourages and educates safe disposal of medications to ensure that the environmental sustainability, and also to prevent health risks from pharmaceutical waste. At the end of the day, it's all centric around resistance. Like I mentioned, exposure plays a part.
Yes.
I think that aside from our generation, we need to think a bit further because resistance not just impacts us, but the future generations to come.
True, true. So that's the right way to dispose your medicines.
Yes,
Okay, at mymedisafe.org.my, right?
that's right.
Okay. So I heard that you also have a call center?
Yes, we do have a call center, which is called the National Pharmacy Call Center,
Okay.
NPCC.
NPCC.
NPCC, the numbers are 1-800, it's toll-free number, 1-800 88 6722.
Okay.
I repeat that, 1-800 88 6722. This landline is available from Monday to Friday, from 8 a.m. to 5 p.m. Yeah, office hours except public holidays.
So we can call them
Yeah.
during that time.
That's
office
right.
Hours,
If you have any enquiries at all, if you have anything that you want to know about the use of medicines, you can always call and reach out to us.
So they can assist. Okay, cool. You have any other website that we can go to?
I will introduce that later as
Okay.
part of my concluding point.
So it's 14 minutes. Yeah. So what is your final what is your take home message for our listeners?
Yeah, so to just wrap it all up, actually, interestingly enough, this talk happens at a really, really crucial time for us because we just only celebrated or rather commemorated our World Antimicrobial Awareness Week. Annually, this happens annually, and it just took place from the 18th
18th?
November, and it ends actually today. Right?
This-
Yeah, it aims to really raise public awareness. So if you go to the Kenali Ubat Anda Facebook page or the websites, you can see this publicly being promoted.
Okay.
Right? And it really gives us awareness on how to control this antimicrobial resistance and also how to use our antibiotics judiciously. Right? So each individual can really play a part in combating antibiotic resistance. So again, number one is this: be completely aware of everything that you are being given, right? Not just antibiotics, of all the medications, but especially antibiotics, because these are not medications you take for the long term.
Yes, correct.
Unlike your blood pressure medications, your diabetes medications, those are long term. Antibiotics are given for a very specific duration of time. You need to ask your doctors whether you completely need them or not, whether it's really required. So awareness is key. That's number one. You need to be aware that the second thing is this: that most infections are commonly caused by viruses
Yes.
and not bacteria, so they may not require antibiotics.
It's a two different thing.
Yes, it's two different things. All right. And the third thing, and this is really important, is that, again, back to the misuse, whether or not you do not take it enough or you stop it when you feel better,
Yeah.
or if you use it prolonged because you feel like you're not getting well fast enough. Misuse, we call this, or basically taking dose sendiri, tambah, you add on your own dose,
You
right?
become your own doctor.
Yeah, and just trying to get better as fast as possible, or even just sometimes just buying online, like I said
Yes.
just now, and treating yourself. All these misuses can lead to resistance, which at the end of the day translates down to the people you come in contact with, your future generations. The impact is bigger, the cost increase, not just the hospitalization stay, but also financial burden on the hospital aspect and also the family aspect, because you got to
Yeah.
care for someone who's sick
True.
for a prolonged period of time, right? This one really can, at the end of the day, we just want to prevent people from really losing their lives out of this. I think it's really important because antibiotic resistance can be fatal, and we of course do not want it to reach that point, right? So that's the third thing I want to say today. So together, we really need to come together, be decisive, have sustained action across all the sectors, not just the public is one sector, the healthcare professionals are one sector, of course, the decision and policy makers are also another sector. We all need to come together to fight this antibiotic resistance and protect our global health together for our future generations. So before I end this, just to tie it all up, like you mentioned, there was another page that we can go to. It's called the Kenali Ubat Anda.
Kenali Ubat Anda. Okay.
This is found on Facebook, Instagram, TikToks. There's a lot of information there, not just on antibiotic usage, but also on other medicines as well. Go and visit that page, and you'll find that you will learn a lot. from all the information that is placed there. And you can stay updated with us from time to time whenever we have campaigns, promotions, informations, road shows, things like that that happen from time to time on different various disease conditions or medicines. We will promote it there, we will put it there, and all the information is readily available to all public.
So go to Kenali Ubat Anda Facebook,
Instagram, TikTok.
Okay. Facebook, Instagram, and TikTok. Okay. We also you can also call 1-800-88-6722.
That's right.
And also go to mymedisafe.org.my. Right, these
Correct.
three things important.
Yes.
Okay, I guess that's it.
Thank you very much for having me.
Thank you, Andrew, for coming and sharing about antibiotics.
It's my pleasure.
Thank you, Andrew.
Thank you.
Okay, there you have it on Health on Traxx with Andrew Yu, a pharmacist from Hospital Kuala Lumpur. We'll be back with more music up next. And up next at 12, we have news with Stella. Stay tuned for more music.